Awesome. I'm just getting my PowerPoint to be my friend. Evening, everybody. I'm in Ohio, so it's 9 here, but it's 6 there, so that's evening for everybody there too. Let me just get this started. Awesome. And then there I am. Hi, everybody. Amelia, can you just let me know? I know, I always double check. Can you see one slide or two?
One slide, you're all good.
Thank you. The multiple monitor life. It's a beautiful life, but you're never sure. So thank you for everyone who's joining live. And I'm sure there's plenty of you who can't make the live event and will be watching the recording. So hello, I'm Tabitha. I am a veterinary technician and dog and cat behavior consultant. And I'm so excited to talk about happy vet visits for your dog. So topics discussed in this webinar will include why is it important for your dog to see the vet. Thankfully, this isn't as much of as an issue as it is with cats, but I do still think it's really important to understand the whys and not just to bring your animals or dogs in when you feel like you're noticing that they're ill. So we're going to go over that just a little bit, how to advocate for your dog and what that looks like. Teaching your dog to love the car and travel, because many dogs arrive at the veterinarian clinic already over threshold is what we call it. So basically in a place where they're pretty stressed, can't think or focus, and that's how they're arriving. So travel and things that you guys can do at home can make a really big difference in not just the travel, but their whole vet visit. And then some tips on actually reducing stress at the veterinary clinic and when it comes to medical procedures. So why is it important for your dog to see the vet? So similar to cats, because some of these things are similar to what I was mentioning with the cats as well. Of course, our animals are masters of hiding pain and illness. I kind of mentioned when the caregiver recognizes that their dog is sick, and that's different than me as a veterinary professional recognizing when your dog is sick, which makes sense. So it can be really difficult to assess and be able to tell if your dog isn't feeling well. And if you can tell, in some cases, they haven't been feeling well for quite a long time. Sometimes it's an acute thing as well, but still, preventative care is better than reactive care. You actually have your vet bills reduced because we can address things earlier, and in some cases prevent disease processes altogether, versus this is right now, my dog only sees a vet every few years and he's in a crisis and that's an emergency. So of course that's going to be more costly because your pet's going to need overnight care and hospitalization. So not only is preventative care better care than reactive care, but it also saves you money, which we all can use more money, of course. Your pet may be overweight or may have pain in some way that you may not be aware of. Because again, many of us look at our pets and we may not recognize you're with your dog every single day, and you may not recognize that your dog is overweight. And that does contribute to arthritis and can kind of exacerbate other medical issues. And we want them to be comfortable just like you do, right? It's also really important to develop a close relationship with your veterinarian when your pet is healthy. This is something that you can do as a caregiver to advocate for your pet. Because when it comes to, I only see the vet when my dog is sick, that veterinarian has no baseline. And what I mean by that is, what's your dog's baseline chemistry, which is blood work where we check their kidney and liver and internal organ function? Or what's your dog's baseline for heart rate, respiratory rate? All of these things are very important for that doctor to have. And if they have that baseline information, they can more accurately and quickly diagnose medical issues in the future. Also, it's great to have a relationship with your vet, because if you have questions or concerns, even if your cat or dog aren't ill, you can reach out and ask and have that relationship, because things come up. As a vet tech and an animal trainer, I get asked by lots of high school friends I haven't seen in over 15 years, random caregiver questions. And I'm glad they're reaching out, but it's best to reach out to your veterinarian, veterinary technicians, and receptionists at the veterinary hospital. And then also, we're doing the best we can in the veterinary world, but there are only so many of us. So you having a relationship with a veterinarian that's already pre-established, if something's like my cat, for example, had an emergency recently and I got her in she was stable, so we didn't have to go to the ER, but I got her into my veterinarian right away. I understand, especially as a technician who has worked in veterinary clinics, we can't always make time, not that we don't care, but I understand that your pet's not doing well, but we have a full schedule of previous clients already. So that's also a really great reason to already have a relationship with your veterinarian. And how adorable is this senior dog? Oh, I love senior dogs. Also, routine veterinary visits help your pet live a happy, long, healthy life, which is what we all want. So kind of like I was talking about before, early detection and intervention allows your veterinary team to treat a disease in the beginning stages. So that's better, and manage the condition with medication, or in some cases, simple lifestyle changes, veterinary visits and testing. And what I mean by testing is diagnostics. So this can be blood work, fecal sample, neurological exam, all of that lovely stuff. And it can help save your pet from pain, suffering, and disease. I cannot begin to express as a veterinary technician how many underlying medical conditions I see in my behavior cases as a consultant, where they have never been noticed for a variety of reasons, and none of them are malicious. And that was the medical issue, was actually the causing or contributing, was a very big contributing factor to that animal's behavior concern. So one of the first things I do is I share my observations with the veterinarian and the client, and we work together to get that. I love that little heart. We work together to get that animal feeling better. And then also, kind of like I mentioned, having your questions and concerns answered. So for example, puppy, adolescent, beautiful senior lab. Ideally, we will be seeing your pet throughout and have a relationship with you and your pet throughout their whole long life, ideally. And a puppy, there's a lot of questions. There's a lot of behavior questions and other things, nutrition questions, things that you can Google, but we've all been down that rabbit hole. And that's really dangerous because it's really hard to know what's correct, what's accurate information. I always use the example of my car. I know nothing about cars. I can't even change my own tire. I know it's sad, guys, but it's okay. I trust my mechanic and I have a relationship with my dealership. So when I wouldn't Google car stuff, and that's way less serious than our living family members, right? Our animals. So being able to address, hey, what's a good resource for me to look up information when I am panicking, because we're all human, because I give my clients websites where I want you to look more and research. Here's books that you can read. I love that you do that. I want to reinforce that, but I help them so they're not just Googling and getting blogs and getting into really dangerous rabbit holes with a lot of pseudoscience and things that can be really dangerous when it comes to animal care and behavior for that matter too. So we all know it's important for our dogs to see the vet. That's why we're here today. And I want to kind of get back on track to advocating for your dog, because even the best veterinary staff, although they love your pet and you, and they're doing their best to treat and manage and help your animal, you have to advocate for your pet. It's the same with humans, with your children. You have to speak up for them. In some cases, various times you have to get second opinions. It's not because those doctors are malicious. It's just, it may not be a good fit, or that may not be their specialty, or they may not be open to referring you to other people, which is usually not a great sign because nobody knows everything, right? So again, just like with us as humans, it's important for us to advocate for our dogs. And here's a few ways that you can start to do that today. So be prepared, right? Prior to the vet visit, be prepared with concerns, questions, and your dog's symptoms. So what you're observing, and I love frequency. So the more data, the better. I don't expect everyone to do a calendar and a chart, but for some of my senior pets, or for some of the clients, pets that I work with who have severe medical issues already, like chronic disease processes, we keep diaries to track appetite, vomiting, bowel movements to see how the medications are working so we can assess and reassess. Because of course, just like with pain medications, an NSAID is great, but we should be reassessing that pain. I shouldn't just say, I'm a veterinarian, here's your prescription, we're good. We should be reassessing and also adding in other treatments, a multimodal treatment to that pain. So how often is your dog vomiting? What does the vomit look like? Smartphones. I know it's weird, but take photos. I love photos of poop and vomit. We're vet techs. It's helpful. So if you don't want to describe it, and if it grosses you out, I understand that. Just take a picture and share it with us at the vet visit. How often are they doing it? See, you might start to notice a pattern before you even bring them into the vet that you could share with us, which is really helpful. Learn your dog's normal and pay attention to changes. You are your dog's caregiver. You know your dogs. You love your dogs. And there are things that you're going to know that we don't. And it may be he always rests in this one area and all of a sudden he stops. That's a really big change from my perspective. And I would want you to share that with us. And that might be a sign to be like, maybe something's going on with my dog, whether it's behavioral or medical. And we always want to rule out medical first when it comes to any behavior concern. So that's just a nice thing. If your dog is having a behavior concern that you're very worried about, medical should always be ruled out first, because in many cases that does not happen. And like I said, I see a lot of medical issues causing the behavior issues I see. No common symptoms of pain. We're going to talk about a few of those. I understand that you're not going to be a veterinary technician, but you can learn how to identify common signs of pain in your dog so you can better assess and see, observe those and share them with your vet. And then once treatment is started, you can assess, oh, my dog's doing their favorite things again with this pain management protocol. This is great. Or he's still not, let me share that with the vet. Let's see if maybe we have to add something in or take something away. Again, every animal's an individual and this is their care as well. Share your observations with the vet. And we want to remember that changes in your dog's daily habits should not always be contributed to aging. So I'm a stickler for this because I hear it a lot. My dog's older. He's just grumpy. No, that's not a thing. He's most likely painful. Or my dog just doesn't like to play. He's older and I'm going to play when I'm 70. It might look different when I'm 90. I'm still going to be playing. Again, it might look different than it does now at 38. And if I'm not, I'm only 38 and I do stretches every single day. And I have exercises and things I do so I can trail run and do my favorite things. So again, this is really important. Age does, as your animal gets older, they are more prone to getting medical issues and having pain, but it is not just a pure, hey, your dog's older, they don't need pain meds, or, oh, that's normal, he's older. Those are things we should not be saying in veterinary medicine, but also that's something that I commonly hear as a myth, and that is not the case. And then lastly, every vet exam should include 2 to 3 short videos of your dogs acting normal. So again, I always have my clients take videos of their dog's gait. So walking from forward and back, like the client takes one backward and forward. So we can really assess that gait, because in the veterinary hospital, they may be fearful. There might be stimuli around where the vet can't accurately assess their gait because there's other dogs and that causes your dog stress. And also your dog is more comfortable in your home. So seeing their behavior and their walk and how they react to things in that environment is going to help that vet better diagnose and treat your pet. Also eating, playing. That's what I mean. Just a minute or 2 videos. Who doesn't love taking videos of their dogs? I love smartphones, but that should just be part of every routine veterinary exam that you share with your vet. And some common symptoms of pain. Again, these are just some common ones to generally check. And these are both for cats and dogs. So changes in eating and drinking. For example, your dog used to eat pretty quickly. And for the last week, he would eat, but then walk away. and then come back. He would finish, but that's a pretty big change. And I would be concerned about that. And I would want to call my vet, right? Or they're eating excessively. I've seen so many animals. Sometimes the caregivers are like, he steals my pizza. He does this, but he's never done that before. That's weird. that means something may be going on. And there are some medical issues that can cause them to have an increased hunger. So again, but that's never thought about. Usually people are just like, oh, my dog's being a butthead. When actually your dog, if that's an acute new behavior all of a sudden, that might be due to a medical issue. Ignoring playtime. I already kind of touched on that. Just overall changes in their daily habits. Losing interest in their favorite activities. What are your dog's favorite things? You know them. Are they doing them all every day? And if they aren't all of a sudden, why is that, right? That might be pain. It could be GI pain. It could be dental pain. It could be bone pain. I mean, there's so many types of pain as we know as humans, right? Changes in social interactions or increased irritability or aggressive behavior. Your cat and your dog used to always get along from what you observed, and all of a sudden your dog is growling when your cat approaches. Something might have happened when you weren't there, but also your dog might be uncomfortable and they're guarding themselves. So they're more, if you have chronic pain or even acute pain, you're more irritable. This is true of our pets as well. So we want to know, they used to love greeting strangers or friends that came over, and now they're withdrawn, for example. That's a change in their daily social interactions. They're sleeping more than usual, or they're house soiling. They're missing the litter box as a cat, or they're going in the house as a dog. These are all common symptoms of pain where you may see those things and you can share with your vet, say, what's going on? Here's some others. There's a lot going on this slide, but I kind of break it down as daily habits, activity level, posture, self-trauma. So again, I kind of touched on those daily habits already. Self-protection, protects a part of their body, won't put weight on a limb. That's a more obvious one where we're noticing an obvious limp. May growl or hiss when other people or pets approach because they hurt. They may not want to be petted or snap at the air when you go to brush or pet them, and that's a new behavior. In many cases, they hurt, right? They're not being grumpy or difficult. They hurt. There's a reason why they're exhibiting that behavior. Again, aggressive, acts out of character, posture. Similar to this dog, they kind of are hunched over. Their back tends to be up. That's a really painful dog. Their head is low. But there are specific postures that we see in really painful dogs. And these are things that you guys can find through a lot of awesome veterinary resources and even their facial expressions. Are they restless? Do they not want to move? I see a lot of dogs where I'll assess, I'll just be at the console and it took them a minute to sit. And no one noticed it until I pointed it out. A human, it would be, right? That's an uncomfortable human. But when a dog does it, once I point it out, people notice it. It took 2 minutes for your dog. They circled 5 times, got up, circled again, and then laid down. It's very likely your dog has some pain. But these are all things that you guys can get a better idea of and observe and share with your vet. Advocate for your dog, right? So if your dog does have pain, if you're aware that your dog has pain because your dog has seen previous vets, maybe you started a relationship with a new vet because you moved or got a second opinion, you want to share that with the veterinary professionals prior to us touching them. If your dog is really sensitive in an area and you know that, let us know ahead of time. Because, for example, me as a fear-free veterinary technician, I'm going to always be gentle and use kind approach when I work with dogs. But if I have to give a under the skin subcutaneous injection, I may not go in that area and just give it in a different area because you shared that information with me. So little things can make a really big difference. Share your dog's triggers. So this is something that we give in fear-free hospitals to clients prior to them visiting. It's just 1 page. And it just asks a few things like, does your pet have any sensitive areas? Check any things that your pet doesn't like getting into the car, entering the veterinary hospital. So for example, if you hit that box, I may have you enter through a side door or the back door versus the front door. That's an easy trigger for me to minimize for your dog, which is huge. Because when we expose our animals to their triggers, understandably, they become fearful and scared, and it doesn't get better. So share your dog's triggers. Understand their body language. That's how they communicate with us. Even just not for vet visits, that's just an important thing to do all the time. And then if your dog has a history of fear, anxiety, and stress at the vet, talk to your vet about pre-visit pharmaceuticals and handling plans. Ask for help. There's behavior consultant, vet techs like me. There's a lot of awesome trainers and behavior professionals that want to help you and your pet enjoy the vet. And we are here to help. If you cannot medicate your dog, that is a very big problem. That's partially what I got into behavior as a vet tech. If you can't bring your dog into the vet, which many caregivers can't because of the fear or stress or fear aggressive behavior their dog exhibits due to past experiences, let us know. And it's not just, here's this anti-anxiety medication. It's, here's this anti-anxiety medication. We're going to minimize your dog's triggers. We're going to create a handling plan. We're going to use gentle control, right? So it's not just one and done, right? We're going to do all of these things to help your dog have a better experience. I can't get too much into body language, but here are a few resources I really love. I'll be sharing the PDF of this, so you'll have access to these just to get some more information about body language that are just short and concise and easy to interpret, so you can learn more about how your dog is communicating with you. And now that we have some tools to advocate for our dog, how can we reduce the stress involved with that travel? Some dogs like to travel. I'll be honest, most of the dogs I work with do not when I first meet them, but fear-free starts at home. So happy car rides. There's a lot of little things that you can do that can reduce the stress associated with travel. So a safe and comfortable resting area. I know that sounds like a given. For some dogs, this might be a crate on a flat surface that they've already been trained to. For some dogs, this may be a harness. There's a lot of dog safe specific harnesses. Whatever works best for your dog, right? A comfortable temperature. If it's really cold, I'm going to warm up the car before my dog comes in. It makes a big difference for me as well, but also for my dog. I'm going to do what I can to create a comfortable environment, that comfortable temperature. I'm going to play classical music. And I do this if your veterinarian isn't utilizing these things, anywhere I go, I have classical music on my phone and it comes with me. So these are things you can play in the exam room too. And classical music helps to drown out some of the stressful stimuli. And it's been proven with research that it can reduce stress. It's an easy thing that we can do to do that. Avoid feeling rushed, plan ahead. If you have 500 appointments that day, maybe not the best day to take your dog to the vet, right? Because you're going to be rushing. If you hit traffic, you're driving, probably not the best, not the less stressful way for your dog because you're trying to get there. And utilize calming aids. So again, there's a lot of different things that might work for your individual dog. I'm a big fan of Adaptil. It's a dog pheromone that mothers release when they're lactating, and they've got it synthesized into a collar, a diffuser, and a spray. So I wear it as a technician every day as a beautiful perfume. But this is something that you can spray your car with 5 minutes before your dog gets in there. Or I work with a lot of vet clinics where we actually place a bandana on the dog or spray it on the towel that they're laying on when they come into the vet clinic. Again, little things. Thunder shirts, calming caps, nutraceuticals. So thunder shirts you can see here. Many of you are probably familiar with those, but I don't see a lot of people, even in vet med, utilizing those as a tool. They're not appropriate for every dog, but in some cases, it can make a really big difference, especially if your dog has a lot of stress associated with travel or the vet. Calming caps are something that, again, they should be trained to. We shouldn't just be throwing these on our dogs, but it helps to minimize visual stimuli. And it's been a game changer for some of the dogs I work with. And I work with really fearful dogs. So this may not be for your dog, but I think people forget about these awesome tools. Other nutraceuticals. So those are just calming supplements like Zilkene or Inksetane or Solaquin. You can definitely talk to your vet about that. And those are something that, along with these other things, can be helpful. And then you see this beautiful ramp. If you have a senior dog or a dog with mobility issues, or even not, I want getting in and out of the car to be easy for your dog. I've seen a lot of dogs create negative associations with the car, and the caregiver assumed a narrative that it was because of this, when actually it was because it hurt so much to get in. So once we helped with that, then the dog actually enjoyed the car, right? Little things make a big difference. Happy car rides, make car rides fun. So instead of just going to the vet, not that we don't love seeing your pets, we're going to just drive to the park, or we're going to go through Starbucks and get a pup cup for your dog. So short drives, other places, just fun car rides, or we're going to go to the pet store, which may or may not be appropriate for your dog because there's a lot of stuff going stimuli in there from a dog trainer standpoint. There's a lot going on, but your dog, if they're showing relaxed body language and enjoy that, it's important to make sure to take your dog on fun car rides. If your dog is fearful of the car, we're going to break it down into small steps. Some key points to remember is we're going to start at a non-stressful point for your dog. So one day you may just go to your car, give your dog treats around the car and go in. It took you 5 seconds, go back in the house. The next step might be opening the car door, giving your dog a Kong in the car, starting the car, and just sitting there for 5 minutes. Again, we're breaking it down into small steps, and we're pairing each step with something your dog enjoys, which this could be food, this could be verbal praise, this could be petting. Food is obviously easier because you're usually a driver, but you can use family members and friends. And it's important to keep it positive. If your dog is exhibiting stress or fear at any of these steps, that means you went to that step too soon. And when we break things down into small steps where your dog can be successful, as you can imagine, we can change underlying emotional states a lot faster versus being like, we just have to do this, get it done, which makes it worse, right? So after I start the car, then I might drive around the block and come home. Then I might start doing those fun car rides. We're going to just go through the Starbucks drive-through or a fast food drive-through, and my dog gets a fry, right? If they like the fry. One fry is not gonna, they'll be okay. Or again, some other fast food places. I know there's banks that have dog treats, which I love that that's becoming more of a normal thing. Yay, dog-friendly life. But then you could start doing those short car rides. Then maybe even, hey, we're going to ride to the vet. Like my dog goes to the vet and we go to the vet on Sundays. We drive there and she gets a scent walk. So she just smells all the grass around the vet, which is great stimulation, mental stimulation for her. It's a decompression walk, but we're also, hey, we go to the vet, you just smell awesome other dogs pee and stuff. And then we leave. So we're also starting to form a positive association with the vet clinic. Bring your dog's favorite bed, brush, treats, and toys. I know this sounds like a given, but I don't see it happen a lot. So bring your dogs. This is an example of what I recently brought for my dog's vet visit. And the veterinary clinic I work with is fear-free and very understanding of animals' emotional state and have all these things available. But I know what my dog loves, and I'm still going to bring all these things. So I had my treat pouch because we clicker train and do a lot of those things. And I had different delivery methods. So this is a Kong bone. This is a licky mat. This is cat food. That's the high value reinforcer. Got to bring the good stuff for the vet. Even if you've worked on happy vet visit stuff, the vet is still a stressful place, right? So you need to bring that really, really good stuff. For my dog, it's cheap cat food. It's her vet treat for blood draws, for x-rays, all that stuff. She gets cat food, usually on a licky mat because that's her preference. But you guys know your dogs. Also, tennis balls. If your dog loves balls, I had one dog who had a lot of stress at the vet and we had to give them a laser therapy, and we postponed it that day because of the dog's anxiety and stress. And I just asked the client, what does your dog really, really love? And this caregiver and his dog were just amazing. And ball is his favorite thing. And I was like, can you just bring his ball next time? And we also scheduled it at a quieter time per day, just a few things that we kind of did to make it less stressful. And that dog, his body language was so much more calm and relaxed. And I lasered him on my own with him on an orthopedic dog mat with his ball in his mouth, to the point where we only changed the ball. We didn't, because we're utilizing non-slip surfaces and all that stuff already. And it went from, this is stressful for him, this is going to take a few technicians, not to hold him down because we should not be doing that, but to assist, to Tabitha can just do this on her own while he enjoys his ball, which is great. Here's an example of my dog. This was a few years ago where we were using a Thunder shirt. At this point, she loves the vet. We've worked really hard where she doesn't need that as a calming tool. That's her bed. I bring her favorite bed to the vet clinic. Oh, she's so cute. You can hear the classical music in the background. I have treats. She's so cute. And this is us just giving her her vaccine. She loves face rubs. Not every dog loves face rubs, but that's really reinforcing for her. Some other tips to reduce stress. Use considerate approach, which we'll talk a little bit more about because I think it's important for us to do that, but also some veterinary staff may not be familiar with what that is. I know when I was a technician, a baby tech, I would not use considerate approach when I approached dogs. And it wasn't because I didn't love them. I was never taught what that was back in the day. And I don't think a lot of us are. So you can imagine most dogs we're meeting, we're starting off already on a bad paw by using an inconsiderate approach. So these are things that you can help the veterinary staff do. Schedule at quieter times. This is more if your dog may be triggered by other dogs or other things. Your dog may have fear of the vet. Quieter is better. So ask the vet, hey, when's your quieter time? My dog, she does so much better at the vet, but I still schedule the last appointment right before lunch or the last appointment of the day again, or I may do it on a Saturday because some vet clinics are quieter that day. Again, simple thing that makes a big difference. Bathroom break prior to vet visit. We all know how relieving it is to go to the bathroom. We've all been stuck at work or in a lecture, especially as a vet tech. I haven't peed for 8 hours, not the greatest. So sometimes I don't think we think about it. We go for a 20-minute drive. Make sure your dog has an opportunity to go to the bathroom prior to the vet visit. It does make a really big difference, a little thing. Notify the vet hospital when you arrive. So instead of going into the lobby and saying, we're here, which can be, there's a lot going on. There may be other dogs, there may be other cats, there may be other species, there may be a client on their cell phone yelling. Again, so much stimuli in that environment, even when the vet is trying to do what they can to reduce the stimuli. And in some cases, vets are not aware of that. So there's even more stimuli, right? So I'm just gonna give them a call, and once we have a relationship, they already know this. And when an exam room is ready, they're gonna have the technician kind of come get me or just give me a call and I'll walk in to prevent the lobby altogether. I work with a lot of dogs who are triggered by other dogs. So if I could just prevent that trigger altogether, what? And from a vet tech standpoint, now this dog is going to be so much more relaxed and not over threshold the moment I come into the room because they were exposed to their trigger 3 times in the lobby, right? Plan the route. So as a caregiver, you may feel like you can't do this, but you can. So for example, before I brought my dog into the vet, I was taking my dog out of the exam room, and my vet is super proactive and awesome, but she was going to get her medication. So I just opened the door. My partner was with my dog, and I walked through to the lobby, and I just made sure no one was out there and that no one was out because my dog is triggered by other dogs. We've worked very hard. Thankfully, she's not as triggered, but I still want to avoid it. So I just did a walkthrough to see what's happening, what things are happening outside before I walk my dog. So here's an example of, this is a dog I worked with. And you can see I'm not pulling him onto the scale. And then he walked off. So I walk with him back around. I placed a towel over the scale because scales tend to be scary because but that's a dog that was actually fired from a veterinary clinic due to fear aggression. And unfortunately, he had a lot of traumatic events associated with veterinary care. So his caregiver is amazing. She's a veterinary technician as well. And we worked together to help him enjoy the vet. And we scheduled his appointments at the end of the day. And even though it was the end of the day, I had the client walk through to make sure no one was there before I took that dog to be weighed. So little things like that can make a really big difference. So considerate approach. You want to avoid looming, leaning, or staring, avoid a frontal approach. So this is just every dog, no matter what, caregivers, animal professionals, all the time. Turn your body sideways as you enter or approach. Avoid this life, which this is what I was, you guys, long time ago, know better, do better, right? I was taught to do what this lovely gentleman is doing. And you can kind of see, this is from What Is My Dog Saying, which is a wonderful resource made a long time ago, but it's a great resource. And you can kind of see this dog is hovering over this dog in a very threatening manner. And this human is kind of basically doing the same thing as that dog. And you can see this dog with the human is kind of looking away, mouth is closed, kind of giving him a cutoff signal, like, please give me space. He is not feeling comfortable. But many of us, including myself, was taught to literally, hey, you're conflicted or you feel great. Let me stick my hand in your bubble, which is not great. So instead, we shouldn't be extending our hands towards pets. We should let them approach us. I may walk in and toss a few treats, and I toss like this, not even like this, because again, I work with very fearful dogs, and this is a very big gesture and can be very scary. So I may offer some treats. If you're a caregiver, allow your dog to explore the room. Maybe even we do training games while we're first getting in the room. I used to bring a snuffle mat to my dog's vet visits so he could snuffle, since she wasn't as comfortable with exploring just yet, but then she could snuffle where she was at. You can bring frozen Kongs and numerous other things for your dogs, not just during their procedures, but to help encourage exploring of the room. And for example, let's say your veterinarian comes in and they want to introduce themselves to you and shake your hand, which is great. Something I used to never think about. And then as I got more into behavior, so much of the time, we as veterinary professionals are reaching over your dog's head to shake your hand. And now I'm just like, oh my gosh, that's so dangerous and stressful. And so that's an example where you can maybe even say to the vet, because they may not even realize they're doing it. And again, they're not malicious. I used to do it, and say, oh, can you just not reach over his head? Let's say hi like this or whatever. Again, planting a seed, helping your dog be more comfortable. If a vet tech comes in and starts interacting with your dog right away and your dog is hiding under a chair, maybe say, oh, he's just a little conflicted. Can you just give him a little space, and we could use some treats to get him out. That tech will be all about that. I can't imagine why they wouldn't be, right? So those are little ways that you can help the veterinary professionals around you use considerate approach as well. Oh, be my friend. There it is. Happy vet visits. So happy vet visits are more if your dog has minimal to no fear. It's more of a prevention type activity, but I would love to see more people doing it. It would be great. So a happy vet visit is just a non-medical visit, or some veterinary clinics call them fun visits, and they're just designed to strengthen the dog's positive emotional response to the vet clinic in general. And they can be used to help maintain a positive emotional connection with the veterinary clinic, or even in cases where there's fear or trauma, used to help change that. But that's where more in-depth behavior mod is being used. And that's where I would recommend working with a trainer or a veterinary professional who is a credentialed behavior professional if your dog has severe fear or trauma, because we would work on that, but it's not as simple as this. So a happy visit, again, you have all your dog's favorite things. It might be a tug toy. It might be treats. I like to have a variety of things. That's important. And we might start in the parking lot. So this is my dog. How I said we go to the vet clinic on Sundays, and she has the best sniff walk ever, because dog, like vet parking lots and grass, so many smells. So that's a happy visit. We didn't go into the vet clinic, but that counts. Here's one where we were working on some cooperative care things in the vet clinic. So in the exam room. So we just went in for 5 minutes that day. We scheduled it. We worked with the veterinary. Of course, we didn't just show up. We don't want to do that. And we just did a little bit of training in the exam room. And then I even had the vet pop in and say hi, said she was available. And that also helps in the training that we were doing. Here's another example where this caregiver, who's a technician as well, is just using her dog's touch behavior to get him to go onto the scale. Because again, we shouldn't be pulling, we should be luring or asking them for a cued behavior. There's a lot of other ways for us to get that weight. So we just go into the lobby, he gets some treats. He might say hi to a CSR or a technician. He gets treats, explores a little, 5 minutes and leaves. Happy vet visits. And when we start these as puppies, that's even better. Ideally, this would be a part of every puppy socialization program, which is, again, why it's important to have a relationship with your vet. Because then when you call and they may not be as familiar with behavior, right? When you call and start to discuss these things, they'll be more open to it. And I've had no issues with the veterinarians that I work with in allowing me to come in. Again, I respect their time and we talk to them first. And a lot of veterinary clinics offer these at no cost, where you just say hi, stop in, and they give specific times that are quieter. A lot of veterinary clinics are starting to just offer these, which is great. Beautiful. Teaching cooperative care. Again, this is more of a preventative thing. So cooperative care involves training an animal to not only tolerate handling and husbandry, but to be an active, willing participant in these experiences. So as you can imagine, many animals feel fear and stress associated with veterinary visits and medical procedures, husbandry. So, I mean, everything from nail trims to grooming to taking medications to actual medical procedures like blood draws. So cooperative care allows the animal some choice and control. And when you have some choice and control, your fear and stress is decreased. And then also by them being a willing participant in their own care, they essentially, their tolerance is built for procedures, because everything may not be 100% cooperative care all the time, realistically, right? In an emergency and things like that. But since that dog has had so many good experiences where they've had their signs and signals respected, they're more likely to tolerate and return to baseline from a traumatic event if they're sick. Not that I'm saying we're going to hold them down. It's just when you go to the vet, when you're sick, I was in the hospital a few months ago, they were all great. It was still really traumatic. So that also helps. And then with animals less fearful, they're easier to handle. Veterinary professionals are obtaining more accurate readings of vital signs. They recover more quickly. I mean, it's just a win-win. So there's a lot of cooperative care resources out there. Thankfully, it's becoming more popular. There's a lot of trainers like myself who can help you with this. There's more and more veterinarians hiring technicians who are interested in behavior, offering these services, but these are just a few examples. So I use something called predictor cues where I hands pinch poke. So I say it before I'm doing it. And my dog gets injections every 2 weeks for arthritis. And her consent behavior is laying laterally on her bed. So if she was to lift her head up, that would be her saying no. And we've worked towards this before me actually giving the injection.
I gave the injection.
So I already gave the injection. I just wanted to end on not the injection, even though she did great.
Not the injection.
Oh, there, I'm saying it. Here's my dog again. So my dog has a very positive conditional emotional response to meds. My partner just says meds and she jumps up. Ignore my lovely mess of a house. We're all human, guys. She jumps up. She's super stoked. Her ears are perked. Her tail is midline wagging, very loose and relaxed. And she loves her meds, which makes all of our lives easier. Here's another example of a technician, a friend of mine, Jessica Benoit, working on cooperative care with a dog that was sedated prior, and they've worked really hard to get to steps like this. This dog's consent behavior is stationing. Whoops, it's going back to this video, which is on that climb. And she uses predictor cues as well, where she says the word before she touches it, because predictability just makes things feel safer. Oh, such a good puppy.
Here. Yes.
And this is huge for this dog because he used to have to be sedated just to come into the vet. His caregiver and his behavior team and veterinary team have just been amazing. This is why we do what we do. I can go on and on about it, but cooperative care is really cool. And it's something that you can start working on if your dog has had traumatic incidences. We just have to break it down more, but also preventatively, it's the greatest thing. So everyone, please do it. And then lastly, I want to talk a little bit about muzzle training, because this is something that I think is a very important life skill for dogs. And I know many of my behavior colleagues agree, but I also know that there's a really huge stigma with muzzles. And I know that they're used inappropriately a lot, not only from caregivers, but in some cases from veterinary professionals as well. So I just think it's really important to teach your dog to calmly and cooperatively wear a muzzle. So training dogs to wear a muzzle is important because, of course, we want them to become accustomed to it and accept it readily when needed or advised. We prefer basket muzzles versus those nylon or mesh muzzles. So a nylon muzzle in an emergency situation for 3 to 5 minutes is understandable, but even veterinary clinics, all the veterinary clinics I work with, they have basket muzzles or muzzles that are similar versus the nylon muzzles. Because with the nylon muzzles, the dogs can't pant, and dogs pant as a way to release stress. So when you take that away and they're already stressed, they escalate, understandably. Also, there can be some safety issues with those nylon muzzles and dogs. We wouldn't recommend them wearing them for long-term unsupervised in any case, but in some cases those are used. But again, we're generally using basket muzzles, even when dogs aren't trained from a safety standpoint. But in a perfect world, I train tons of dogs to be muzzle trained. My dog loves her muzzle as much as she loves her leash, and yours can too. And I consider a basket muzzle kind of like a seatbelt, right? It can help decrease restraint. So I tell this to caregivers a lot. My dog is not aggressive, but also aggressive isn't a diagnosis, aggression, right? If you started attacking me, or if I hurt myself and you touched it and I punched you, I would not be labeled as aggressive. That's a normal behavior. It's just me showing things. So when it comes, and when a dog is fearful, they're more likely to have aggression. And if a dog's painful, which what do we see at the vet? Fearful and painful animals. So I always use the example, my dog is never going to be injured severely, and I'm just going to go with that. But let's say she is muzzle trained, and let's say she had to go to an ER where maybe I don't have a history with that team, and they may not be familiar with fear-free or low or gentle control. And also my dog is in severe pain and they have to stabilize her. My dog is muzzle trained. So when my dog goes in with a basket muzzle, automatically the veterinary staff feels calmer and more relaxed. So they're less likely to use force and more depth restraints because they feel safer, even if they aren't familiar with gentle control and things like that. It helps to decrease restraint and then increases empowerment for your dog. So muzzle training is great. This is a wonderful infographic from Muzzle Up Project. You can see why use a muzzle. There's a lot of reasons. Accidents happen. When I'm in pain, I might bite, even if I've never, which is appropriate. It's the law in some places. I work with some dogs who have pica. It's not as common as I hear it thrown around, but we can't have that dog eating rocks. That's horribly dangerous. So we're going to muzzle train them and supervise them when they go outside, right? When people see my muzzle, I really love this one because I work with a lot of fearful dogs and I love humans, but we love to go up to them without consent and not using considerate approach. So sometimes when a caregiver sees a dog with a muzzle walking, or they give my dog space, and I'll take it. That's great. I want that. They might be scared at the vet. It's also a safety and management tool. As someone that works as a behavior consultant, safety and management is first things first. And if I'm introducing dogs, or a dog to a cat, or a dog to a child, all of these things, having a seatbelt like a muzzle is going to be really helpful. And when it comes to muzzles, it's really important to make sure they're well fitted. We're not just, again, throwing a nylon muzzle on a dog. I'll get a little bit more into that. But there's a lot of great resources for muzzle training. And I have a video on how I muzzle train my dog, but it's pretty long. But if you want that, I'm happy to send that to you. There's a lot of really great resources where you can learn more about muzzle training your dog, which here are just a few. Muzzle Up Project, Fear Free Happy Homes, synergybehavior.com. They have wonderful, numerous, not only visual resources like handouts and things that you can share, but also videos of breaking down the training processes. And then also, these are just two of the favorite muzzle places, because again, muzzles are becoming more well-known. Trust Your Dog and Boomos, these beautiful colored muzzles where you can get them personalized and custom to your dog. And I love it. I love teal, purple, all the bright colors. Baskerville muzzles, that's what I started with my dog because they were easily accessible and I could purchase them in most pet stores. And then I may have my clients kind of bling them up with tape or like the different colored duct tapes and things like that. Of course, so it's still comfortable on the dog, but to help break that stigma, because again, bad dogs aren't muzzled dogs, right? Muzzles are seatbelts, they're a safety thing. Keep calm and muzzle on. Yay, muzzles. And then I just wanted to talk about, because I know that was a lot of information, but a lot of things that you as caregivers can do every day when it comes to interacting with your dog. And this doesn't just go for your veterinarians, this goes for your groomers as well, or any other animal professional that you may be working with. So when it comes to just a few considerations when finding a vet, I am a huge fan of seeking out fear-free professionals, and you can find them at fearfreehappyhomes.com. And for people who may not be familiar with what Fear-Free is just this initiative that has been started, and low stress handling with Dr. Sophia Yin. She started it quite a long time ago, but thankfully as a society, we've gotten a lot better at addressing not only the physical well-being of humans and animals, but the emotional well-being. And we still have a long way to go with both lovely humans and animals, but that's what Fear-Free is all about, addressing the physical well-being, but also the emotional well-being of the animals. We understand through time, we call it practicing vet men because we're always improving and getting better. And now we know there is no reason why 3 people should be sitting on a dog while they're defecating and terrified. There's no reason for that. Things like that. Obviously I'm a little sensitive to that. But that's what I was taught to do as a vet tech a long time ago. So even if you see people who may be a little more forceful with their restraint, advocate for your dog, but also be kind to that person because they may not know any better. But also it's important for you to advocate for your dog. And if they aren't open to that, maybe finding a veterinarian practice who is more open to those techniques. And I always tell my caregivers, handling fearful animals is a skill. And I teach it as a skill, but not everyone is comfortable with that skill, and that's okay. So if you have a really, really fearful dog who has a lot of triggers, we may go to a specific vet that is more comfortable at dealing with that. Just like there's some vets that are specialty in some other things that I would go to for said things. Same thing. Observe how the veterinarian and staff members work with you and your dog to reduce stress. So how are they treating you? Are they answering your questions? Do you feel comfortable asking questions? Do you feel comfortable advocating for your dog? Hey, when they mention they're going to take the dog in the back to draw their blood, you can just say, would you mind doing it with me? And there are rare cases where the dogs actually, the humans may cause some stress, but that is not as common as you think. So that can be a way to start that conversation, right? Or I'm going to just let my dog have this frozen Kong. I'm going to put some churro in it, something really good, while he loves to have his blood drawn on a leg because then they're away from his face. And you might know from previous experience, and that technician has never drawn blood on your dog. At your last vet clinic, they always drew from a lateral saphenous, right? That's something you should share with us so we can help you and do the best for your dog, but also the best for us. Check on professional accreditations and experience. Again, accreditations are important. Of course, there should be DVMs, registered veterinary technicians, that type of thing on staff. Make an in-person visit to vet practices prior to going. Just maybe check in. Of course, cleanliness and organization. It's not common, but there have been some places that I've seen. And if I was a caregiver, I would not be comfortable taking my animal into there just based on the first kind of things aren't clean, right? Because if things aren't clean, that's saying a lot, right? So make an in-person visit. I'm also a huge fan of making an in-person visit to meet the vet. Now you need to pay them for their time and schedule that because our time is valuable, but also, and I think a relationship with a veterinarian a veterinary technician, a veterinary hospital is such a personal thing. We all love our animals so much. So, hey, let's schedule a 15-minute appointment and I can just talk to the vet and see what they practice and what they're comfortable with and see if you're a good fit. And that's okay. That's a great thing to do. And then also trust your gut. If you're uncomfortable, that's okay. And if you may not be comfortable enough to say something, I understand that's conflict and that can be difficult for some people. So trust your gut. And if you're not comfortable, whether it's you're okay with how they treat your dog, but you're uncomfortable with how they treat you, going to find another vet that's a better fit for you is okay. That doesn't mean that veterinarian you were seeing was a bad veterinarian. Their communication style might just not be good for you. So I think it's really important to trust your gut as well. So in conclusion, I love my senior dog. She's so beautiful. Sorry. She's right outside and I'm still like, I love my dog so much. You guys get it. You're dog people. Make your vet appointment today. Your dog will thank you. Beautiful senior girl. Thank you for listening, everybody. I'll hang out if there's any questions. This is my Instagram and Facebook. I share quite a lot of infographics and helpful videos and resources, and I have quite a few resources to download on my website for free as well. So don't hesitate to check those out. But thank you, everybody, for hanging out with me this evening, and I will check to see if there's any questions.
So if you have questions, feel free to put them in the Q&A and we can go through and answer them.
Oh, someone asked about considerate approach, but I know I talked about that. So the way we approach the animals, but it was probably before I got to that slide. So we're good there. Awesome. I think we're good. And if you guys have any questions, you can always reach out on my website and I'd be happy to answer those. Oh, wait, someone's popping in. How effective is the Adaptil spray? So when it comes to any of those calming aids that I mentioned, I think it is species specific and individual animal. So I feel like it's very effective, but I think when I hear people talking about Adaptil, or for example, there's certain things as a veterinary technician, behavior consultant, I always have a non-slip surface for dogs. I'm using gentle control. I'm always using considerate approach. I'm always assessing body language. All of these things make a big difference, which is why when I'm handling dogs, drawing blood and things, there's minimal to no, there's restraint, but it looks very different than what people think restraint is, which is like this. That's not what it looks like in most cases, because I've done all these things to create an environment that is relaxing. So I think Adaptil is a really helpful tool. What I hear people say sometimes is, oh, the Adaptil did nothing, or those meds did nothing. And that's where I think things get dangerous, which is why I kind of specified with the pre-visit pharmaceuticals, because not that I've seen it happen, but I have. And I think sometimes there's just a miscommunication or misunderstanding, again, through things I just see outside in the world, where a pre-visit pharmaceutical, an anti-anxiety medication is prescribed, but then gentle control isn't used, considerate approach isn't used, and they're like, we just can't do it. So there's no such thing as some magic thing. If there was, I love you guys, but I would be in Hawaii. I would have trademarked that and I would have tackled that. So I think when it comes to, as a technician who handles animals, or even a caregiver who advocates for my animals, there's lots of little things that take minimum to no time for me that may make a big difference for my dog. So when it comes to like Adaptil and classical music, there is research to support this as well, but it's tiny things and they do make quite a lot of a difference. But when people are like, just the Adaptil didn't work, that's not how any of these tools work, right? So we kind of have to approach things from a whole. Thanks. Favorite cooperative care training sites or webinars? Go. I have so many. So of course, I have textbooks in here. If you really want to nerd out, because I think it's the greatest book ever, it's called Cooperative Veterinary Care. It's by Monique Fairchild and Alicia Howell. It's more of a textbook, but it's written in a way that the general public could definitely understand it. And if this is something that you are passionate about, I highly recommend that book. Also, there's a few, Deb Jones has a cooperative care Facebook group if you are on social media, and that's a really good resource that's well moderated. That's an option. And then as far as cooperative veterinary care webinars, for the general public, they're harder to find. And now, see, you're giving me ideas, because all the ones I'm thinking of are usually at veterinary conferences, and if I was not a technician, I wouldn't be going to veterinary conferences. So I think in the cooperative veterinary group and between that cooperative veterinary care book, and then there is a trainer called Laura Monica Torelli. I should spell her name, but she has a lot of great resources too. Karen Pryor Academy has a course called Better Veterinary Visits, which even if you are not a trainer, it's something that you can do online that's easily accessible that I think would be great. So those are a few of the things off the top of my head. Also, I have cooperative veterinary care webinars and workshops online once or twice a year through Chirps and Chatter with some other veterinary technician specialists in behavior. So look out for those because we have one coming out next year. Will this enlightened approach, oh, I love that you said enlightened, eventually be expanded to feline care? Yes, it is already there. So I'm not sure if you were here for the Tuesday webinar where I covered feline care and fear-free, feline-friendly practices. So there's feline-friendly and then low-stress handling and fear-free. And I always joke that I think there should be a lot more organizations dedicated to it because handling and touching animals is kind of a big part of our job. But there are a lot of resources for cats out there. And as far as cooperative care, it is, I'm not going to lie to you, it is more limited. I do cooperative care for cats and it's getting more and more traction and more popularity, but there is quite a few things you can do for your feline friends to reduce fear and stress and advocating for your cats. And I have a lot of resources on my social media for cats. Cats are, I have a special place in my heart for cats. And I do think that there are, even from a veterinary standpoint, for veterinary technicians, back when I was trying to learn more, it was hard for me to find information. So again, it's getting better, and fear-free also works with felines as well. So a lot of these things I talk about can apply to cats, but we just change it up a little bit based on them. Wonderful questions though, everybody.
All right, I think that's all. So thank you all so much for attending this evening. Again, I will send out the recording to everybody with a follow-up email and a PDF of all the slides. And thank you so much to Tabitha for presenting this wonderful webinar this evening.
Thanks for having me and bringing up this really important information. Have a wonderful night, everybody.
Bye. Thank you.